santé et possiblement plus de morts. So I'm worried that if this trend continues, we will see an increase in social disruptions, including more class and school dismissals, and the reintroduction of restrictions on gatherings in homes, and perhaps in public settings, such as restaurants and bars, cinemas, fitness facilities, and other businesses. Too many people will have to be isolating for the holidays to prevent transmission of COVID to their loved ones. So our rate of infection across Ottawa is similar to what it was. Higher rates, particularly among elementary schools and in extracurricular settings where people are not vaccinated. This increase in outbreaks with COVID-19 introduced into schools has been explosive this week. The science table data is also pointing to growing challenges with higher rates of COVID-19 due to the Delta variant currently circulating. And at the same time, we continue to learn more about the transmissibility and the virulence of the Omicron variant. So the risk is here now. And what we choose to do today will make a difference in the coming weeks and months. To reduce community risk, I'm urging all individuals to pause and to limit certain activities before, now, and during the holiday season. It's particularly indoor activities where it involves individuals who are not yet fully vaccinated and where masks are not being worn. Le risque, il est ici, maintenant. Ce que nous choisissons de faire aujourd'hui fera une différence dans les semaines et les mois à venir. Pour réduire le risque communautaire, j'insiste que tous les individus prennent le temps de prendre une pause et limiter certaines activités maintenant, avant et durant le temps des fêtes. En particulier, les activités intérieures dans lesquelles participent des personnes qui ne sont pas encore complètement vaccinées et où il n'y a pas de port de masque. I cannot stress enough the importance of getting vaccinated, wearing a mask and maintaining physical distance from others. Daily screening before going to work or school in person, and staying home when getting sick and getting a test for COVID-19, these are also key. However, testing usually detects COVID-19 after it's been transmitted further. And the best way to limit passing COVID-19 on is to prevent the close contacts in higher risk settings. So this means limiting the number of extracurricular activities for children who are not yet fully vaccinated, especially where masks are not worn and distancing is not practiced. I know these activities are important for children, my children too. Now is the time to prioritize school participation. That's what we need to prioritize for children. Avoid the 3 C's: crowded places, closed spaces with poor ventilation, and close contact with others from multiple households. Rappelez-vous des 3 E. Évitez les endroits bondés, évitez les espaces clos, et évitez les contacts étroits avec des membres de plusieurs domiciles. These actions are necessary to help prevent the spread of the virus, keep kids in school, and reduce the risk to our health and social activities that we have been able to enjoy once again. So while there is reason for concern, you can hear it, we need to remain vigilant. There's also good news to share. More and more people are protected with vaccination. Vaccination provides good protection against ending up in an intensive care unit. To date, 82% of eligible residents are fully vaccinated, and 87% have received at least 1 dose. And I'm incredibly pleased to see the progress we are making with children in the 5 to 11 age group. More than 40% have put on a brave face and rolled up their sleeve and received their first dose. There's still a lot of capacity for children's immunization, so please book your child's appointment today. or simply drop in to one of the school-based clinics that we're running in neighborhoods across the city. The time to protect your children with vaccination is now. The rates of COVID are growing very steeply in children 5 to 11, and the risk of COVID is expected to keep growing. Maintenant est le temps de protéger vos enfants par la vaccination. Puisque le taux de COVID augmente très rapidement chez les enfants de 5 à 11 ans et que le risque d'exposition à la COVID est attendu d'augmenter aussi. The schedule of school-based clinics, which don't require an appointment, is on the Ottawa Public Health website, and I encourage people to drop in as soon as they can. And I do want to caution that although this is notable progress, we won't see a significant impact on the vaccination in schools, in elementary schools, until some time into the new year when we know this younger age group is fully vaccinated with 2 doses, so likely into February. So let's keep up the progress, keep going with the first doses, and we'll get there together. So modeling from the province this week shows that vaccine effectiveness in Ontario remains very high, but experience in other countries suggests that we will need to boost immunity with 3rd doses. And starting on Monday, December 13th, next Monday at 8 in the morning, residents born in 1971 or earlier will be able to book a 3rd dose. That's the provincial booking system that opens, but I really want to encourage Ottawa residents who meet the criteria to reach out to local pharmacies. There's a pharmacy locator that's available on the provincial website to find pharmacies that are providing the booster doses. And some primary care physicians are also providing 3rd dose boosters. So it is a strong recommendation that residents book an appointment or drop into a pharmacy for a 3rd dose as soon as they become eligible. Je recommande fortement que les résidents prennent un rendez-vous pour une 3e dose dès qu'il devient admissible. And this, along with continuing to follow the public health measures, will help reduce the burden on our healthcare system in the weeks and months ahead. So as the holiday season continues, I want to remind all of us that our actions make a difference to keep each other safe when we're gathering. And I know it feels like we missed out on a traditional holiday last year. And so this year, it's better. We're in a dramatically better position thanks to the vaccine. And we must continue to practice safer behaviors, especially when it comes to protecting people around us who are at higher risk and people who are not yet fully vaccinated. So while gatherings are currently permitted, families should consider their own unique situations when choosing to gather with others. Is there someone who may be at higher risk? What's the vaccination status of other guests? Malgré que les rencontres sont présentement permises, les familles devraient prendre compte de leur propre situation unique quand ils choisissent de se réunir avec les autres. Est-ce qu'il y a quelqu'un qui est à plus haut risque? Quel est le statut vaccinal des autres invités? Choose ways to make gatherings safer, such as limiting the number of guests, taking activities outdoors, having hand sanitizer available, opening a window to increase ventilation, maintaining physical distance and wearing a mask if indoors with someone who's not vaccinated or whose vaccination status isn't known. And as always, stay home if anyone in the household is sick, even if the symptoms are mild. And so speaking of having symptoms that should be prompting COVID testing, I want to speak a little bit more about testing. Earlier today, the Science Table released a brief related to the use of rapid antigen tests for voluntary screen testing. Voluntary screen testing is the practice of testing asymptomatic individuals at regular intervals in settings where the risk for transmission is moderate, such as schools and workplaces. And the Science Table's now recommending using this testing approach in elementary schools and a test to stay approach for individuals that would be contacts in schools who have been exposed to someone with COVID, but who do not have any symptoms of illness. So we will be taking further action based on this science. The federal and provincial ministries of health are planning to offer pop-up rapid antigen test distribution sites in Ottawa. And the province has informed us that they will be providing rapid antigen test kits to families over the holiday break. Les ministères de santé fédéraux et provinciaux planifient la mise en œuvre de sites de distribution temporaire des tests antigéniques rapides à Ottawa. La province nous a aussi informé qu'ils vont fournir ces tests aux familles durant la pause des fêtes. So these tests are an additional screening tool for asymptomatic individuals who are not known to have contact with a case of COVID-19 and who would like to take extra precautions. So to date, we are using the rapid antigen tests in two schools, Carson Grove Elementary School and Chapel Hill Catholic School. These are being used after students have returned following school closures to help parents with an additional screening tool and to help monitor for any risk of ongoing transmission more closely. And Ottawa Public Health is also working right now to offer the rapid antigen tests in other schools where COVID-19 rates are high. The rapid antigen tests are for asymptomatic, unvaccinated students to use while attending class, not the students who've been dismissed as part of an exposed cohort or as high-risk contacts. So for students that are high-risk contacts or students that have symptoms, the rapid antigen tests are not appropriate, and these individuals should be tested using the lab-based PCR tests available from the school or at an assessment center. Pour les étudiants qui sont des contacts à haut risque ou les étudiants qui ont des symptômes, les tests antigéniques rapides ne sont pas appropriés. Ces individus devraient aller se faire tester en utilisant un test PCR disponible dans les écoles ou à un centre de dépistage et d'évaluation. So while testing and managing confirmed cases helps, that alone is not enough to reduce the spread of COVID-19. The natural time that it takes for someone to seek a test, the test to be taken, processed, reported, and then for people's contacts to be named and reached, that gives time for exponential growth to occur if the other precautions aren't in place. So using the prevention measures that I keep mentioning, it does make a difference, even with Delta and Omicron variants. So lastly, I want residents to know that I have a lot of hope for 2022. I know the news of Omicron variant is causing some people to feel anxious. And after almost 2 years into this pandemic, we are all feeling like we would like to be completely done with COVID. And if there's one thing I've learned these last 2 years, it's that we are braver and more resilient than we might realize. We are strong enough to keep going. And so my advice is this, to find some joy, whatever that means for you. Every day, set aside a little bit of time, even if it's just a few minutes, for a cup of tea, and do something that brings you joy. Mon conseil, c'est ceci, trouvez de la joie, peu importe ce que cela veut dire pour vous. Chaque jour, réservez-vous du temps, même juste une couple de minutes, et faites quelque chose qui vous rende heureux. For me, I've started knitting little gifts for people, and I am making sure I get outside for exercise with a friend when possible. I never regret that, and it helps through this time. So I wish the same for you. Thank you, merci, and miigwech.
Okay, thank you, Dr. Etches. Merci beaucoup, Dr. Etches. I'll now invite each media agency in reverse alphabetical order to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé. Chacun pourra poser une question ainsi qu'une question de suivi. Effectivement, on va commencer avec Radio-Canada. Frédéric Pépin. Frédéric, c'est à vous.
Oui, bonjour, Dr. Etches. Alors, c'est une conférence pas mal chargée aujourd'hui. 2 questions pour vous. Vous en avez beaucoup parlé, là, les recommandations pour les tests dans les écoles. Je veux juste vous entendre clairement. Là. Santé publique a entendu ce que recommande le groupe et vous allez en envoyer des tests, vous allez en donner dans certaines écoles. Pouvez-vous juste réviser cette partie-là en français, s'il vous plaît?
Oui, j'apprécie l'évaluation des dépistages antigéniques rapides que le table de séance a fait. C'est clair que c'est un autre outil d'utiliser les dépistages antigéniques rapides. Et pour nous, nous avons déjà essayé leur utilisation dans 2 écoles. Et aussi, je pense maintenant aussi 11 autres qui sont presque là d'avoir accès aux dépistages antigéniques rapides. Pour les écoles, c'est les personnes non vaccinées et sans symptômes où on peut utiliser ce dépistage chaque semaine pour une autre méthode d'évaluer si COVID-19 est là. Et oui, c'est la province et le gouvernement fédéral qui ont les dépistages, qui fournissent les dépistages, mais avec accès, on peut continuer d'augmenter cette approche. J'ai aussi mentionné que le programme d'avoir les dépistages rapides, antigéniques rapides, pour les fêtes, c'est un programme que la province va fournir pour chaque étudiant. Ça commence, on va soutenir cette approche. Et aussi, il y a une idée de la province de fournir les dépistages antigéniques rapides dans la communauté pour les fêtes, avant les fêtes. Et aussi, on va soutenir cette approche où le taux est plus haut. C'est clair qu'il y a certains quartiers dans notre communauté maintenant avec une grande explosion. Non, je ne sais pas si c'est un mot en français, mais c'est explosif.
Explosion, oui.
Oui, OK. Par exemple, à Barrhaven, nous avons beaucoup d'écoles là où la COVID-19 a causé une éclosion, touché les écoles, et c'est important pour les écoles de rester ouvertes. Alors, c'est un autre outil qu'on peut ajouter. Et c'est dans les quartiers avec les taux plus hauts où on va continuer de procéder avec l'utilisation des dépistages antigéniques rapides. Finalement, je peux juste aussi clarifier pour les gens avec des symptômes, on a l'autre chose. Hein, le trousse, on peut faire eux-mêmes. En anglais, on dit le take-home kits, c'est le dépistage PCR. Ça, c'est déjà disponible dans chaque école. C'est recommandé pour les gens avec les symptômes et les gens qui sont les contacts de quelqu'un avec COVID-19. Est-ce que ça aide? C'est plus clair?
Oui, okay. Oui, ça aide. Et je vais me permettre ma deuxième question tout de suite. Vous avez commencé votre point de presse, on le voyait dans vos yeux, là, vous êtes inquiète, le docteur Etches. Est-ce qu'on dit aux gens, là, les rassemblements de 25 personnes chez vous, tels qu'autorisés par le gouvernement provincial, il ne faut pas faire ça pendant les fêtes? Est-ce que c'est ça que vous dites aux gens qu'il faut revoir les plans pour Noël?
Premièrement, c'est clair que la vaccination fournit beaucoup de protection. Alors, ça dépend. Est-ce que tout le monde là sont vaccinés? Ça, c'est bon. Mais sinon, et s'il y a les enfants, oui, qui n'ont pas l'accès au vaccin, les enfants moins de 5 ans, ou les gens avec entre 5 et 11 ans aussi, c'est juste une dose, c'est pas parfait. On a besoin de 2 doses pour la bonne protection. On a besoin de penser à limiter le nombre de personnes dans un événement. À l'intérieur, où on ne porte pas les masques. Alors, c'est différents niveaux de protection. On peut ajouter, limiter le nombre, ouvrir les fenêtres, utiliser les masques. On peut choisir avec caution les méthodes de réduire le risque.
Merci, Dr. Etches.
Merci, Dr. Etches. Merci, Frédéric. Avant de continuer, ce que j'ai pu comprendre, c'est qu'il y a une couple de secondes, des paroles de Dr. Etches qui a été un peu coupé sur le fil de diffusion en direct sur YouTube. Pour les journalistes qui sont sur YouTube, on s'excuse pour ce détail technique, mais ne vous inquiétez pas, l'énoncé complet vous sera disponible en ligne dès que possible. So just before we proceed, from what I can understand, a few seconds of Dr. Etches' opening remarks may have been cut off on the YouTube live stream at the beginning of our media availability. And for the reporters that are online watching on YouTube, for that, we really apologize. And worry not, though, because Dr. Etches' full remarks will be available online as soon as possible. Okay, now, without further ado, our next media is Jackie Miller with Ottawa Sun. Jackie, over to you.
Thank you. Dr. Etches, you mentioned that you would be taking action on the recommendations in the COVID science table report this morning. I'm wondering if that means that elementary school kids in Ottawa will be getting weekly rapid tests. The Ottawa indicators used in the report say that that would be a good idea. Is that something that you can do on your own, or do you have to wait for the province?
No, sorry, that's not the best way to start by saying no. So the point is that we do see the value of adding in rapid antigen testing in schools where rates are higher. So yes, we will be extending that to schools where the rates are higher in the community. And what we're doing right now is that. So we've started in 2 schools already with their use, and we have another 11, I believe, that are about to implement. So we're looking at the rates of COVID in the schools, in the communities around the schools, and then we're proceeding to make the rapid antigen tests available for unvaccinated, asymptomatic people to use on a voluntary basis once a week as an additional way to assess, the risk of COVID in those schools.
Okay, just so I understand that the 2 schools you mentioned, those tests were given to kids after a school was closed, but you're saying that...
Yeah, the next 11 are to use right now as the schools are open where we're seeing higher rates.
Okay, so similar to what was recommended in...
Correct, that's right.
And does that qualify as my follow-up, or can I ask another question?
I think that's a clarification question. You're okay. Go ahead.
Thank you. I'm wondering if you've urged people to limit their gatherings inside, would you consider a Section 22 order lowering the gathering limits inside, as has been done in several other areas in the province that now have higher rates?
I'm hoping that you can help convey my strong recommendation that people take caution and limit their contacts where they're indoors without vaccination and without masks. Orders are there. They're a possibility, but it's not what changes things. I think people know what to do at this point in the pandemic. People need to hear clearly that this is a time to go back to that conscious thinking about what are the different ways to prevent COVID transmission in this situation, and to choose the things that will make a difference to decrease COVID transmission. So if we can all be clear, this is the time now to think about, decreasing the risk of transmission, using those tools that we have. I think this is what I hope people can take away today.
Thank you.
Okay, thank you very much, Jackie and Dr. Etches. Next up is Elizabeth Payne with the Ottawa Citizen. Elizabeth, over to you.
Hi, thanks very much. Dr. Etches, can you talk a bit, you've talked about these cases in schools, but can you talk a bit what you've seen in the last week and what the numbers in terms of percentage increases and so forth are, and what other signs that have gotten you very concerned about where Ottawa is right now?
Yes, and we can certainly follow up with you too if you want more specific numbers, but what we're seeing is a steep rise in the number of people testing positive, especially among 5 to 11-year-olds. That rate is growing exponentially. And it's also then with more COVID in that age group, it's leading to a large number of outbreaks. So again, in elementary schools, right, where people aren't vaccinated. And the amount of COVID in our community that's coming from this age group has continued to increase. The rate of growth in that age group has continued to grow. And so it's about pausing and taking a look at then how do we decrease the places where people are in contact with each other without masks indoors, and encourage vaccination of this age group too. That I have heard some people say, I'm just going to wait and see what there's no need to wait. This is a good protection. It's available now, and the risk is now. So I think this is what's standing out this week. The rapid difference that we're seeing in this population.
Okay, and I mean, one of your asks is that people limit, and I would like you to clarify this, is to do it with extracurricular activities. Is there actually evidence that asking people not to go to events like this when they continue to be open works? Do you feel, I mean, is someone likely not to go to a basketball league when they think other people are still going to be there if there's a request to at this point, versus changing regulations about how many people can gather?
I really think that people will make good decisions when they're informed. So each family is different, and they know extracurricular activities are important for their children. Like this is what we've seen. It's why they're available, because we're prioritizing children's activities. In Ottawa, we don't have a requirement that for children to participate in extracurricular activities, they have to be vaccinated, right? We've tried to make sure there aren't barriers, because these are important activities for children. But they're not the most important activity. School is the most important activity. And so it may be time to pause. And I'm not sure parents have heard this presented this way, that if we have to make a choice, it is important to choose school first. And so parents are in the best situation to understand, how do I prioritize? Am I going to choose that basketball game because that is what's most important for my child, and I'm going to let go the martial arts activities? Like I'm saying limit. So instead of doing 3 different extracurricular activities, think about which ones are lower risk, choose the lower risk ones. And if you can be vaccinated, that's what we're looking for. If you can wear a mask, make sure the mask is on properly. We're hearing and we're seeing that these tools that help limit COVID transmission are not always in place in sports activities, and we can use them. You can use masks well, and it will make a difference.
Okay, thank you.
Thank you very much, Elizabeth. Thank you very much, Dr. Etches. Prochainement, nous allons procéder avec Julien Paquette à le droit. Julien, c'est à vous.
Merci, Maxime. Donc, ce que j'aimerais savoir, je me rappelle de votre propos l'an dernier, à ce point-ci de l'année, on était à l'heure des bilans de fin d'année, et vous disiez avoir beaucoup d'espoir pour l'année qui s'en venait, avec les vaccins qui arrivaient et toutes ces bonnes nouvelles-là qu'on avait. À quel point est-ce que c'est décourageant, dans le fond, d'arriver un an plus tard et bon, vous parlez de taux de transmission qui sont similaires à ceux de la fin de l'année passée? Est-ce que c'est quoi l'état d'esprit, dans le fond, quand...
Oui, j'apprécie votre question, parce que c'est difficile de voir l'espoir quand on est concentré sur certains nombres. Mais on peut voir la raison pour l'espoir quand on regarde les chiffres dans les hôpitaux. C'est pas beaucoup de gens dans les hôpitaux maintenant. Et c'est sérieux pour les gens dans les soins intensifs. C'est sérieux encore. On voudrait diminuer le risque là. Mais ça, c'est bonne nouvelle. Et pour moi, on peut voir une journée quand tout le monde a suffisamment protection immunitaire. Ça va arriver. Le problème, c'est aujourd'hui, la population non vaccinée, avec pas assez d'immunité, c'est encore un peu grand pour gérer la situation. Quand on regarde les autres pays, le Royaume-Uni, aussi l'Allemande, on n'a pas juste à ce moment la capacité de gérer la situation, éviter la pression sur le système de la santé. Mais ça va arriver. Et l'idée, c'est de continuer de diminuer la COVID-19 dans la communauté jusqu'à le point où on peut arriver à une bonne immunité sans la pression sur le système et les décès pendant le voyage. Je ne sais pas si c'est clair, j'espère. C'est vraiment meilleur aujourd'hui, mais c'est pas à la point de juste gérer la situation s'il y a trop à un moment. On a besoin de continuer avec un niveau de COVID-19 gérable et on va arriver à la situation meilleure pour tout le monde.
Parfait, merci. J'aimerais aussi vous demander s'il y a des mises à jour à offrir concernant la transmission ou le dépistage du variant Omicron qui, bon, je n'ai pas vu, pour l'instant, en tout cas aux dernières nouvelles, on n'a toujours pas de nouveaux cas à part les 4 voyageurs qui ont été identifiés il y a maintenant, on dirait presque 2 semaines. Donc, est-ce qu'on s'attend toujours à voir ce variant-là faire sa place à Ottawa? Est-ce qu'il y a des récents plus de développement, dans le fond, sur cette question-là?
Oui, vous avez raison. On n'a pas confirmation de notre cas de Omicron. Et ça prend temps de le trouver parce que le dépistage, c'est clair maintenant, le premier dépistage ne trouve pas tous les cas et ça prend de 7-10, peut-être plus jours pour le séquençage des variants. Il y a ces séances qui démontrent que c'est probablement ici, c'est probablement quelque chose, c'est tellement difficile de complètement confiner, contrôler. Ça va être un variant probablement plus grand, dans un plus grand nombre de personnes ici. Mais nos actions font une différence. Si on peut diminuer le taux de transmission, ça aide beaucoup avec de maintenir une situation gérable. Alors, oui, on apprécie la coopération aussi des voyageurs. C'est difficile maintenant pour les voyageurs, je sais, mais ils coopèrent avec les nouvelles restrictions à ce moment et ça aide aussi.
Juste une petite clarification. Là. Vous dites que ça prend 7 à 10 jours pour faire le suivi sur quelle souche du virus dans un cas de dépistage positif. Donc, ça veut dire que la majorité des cas, que ce soit même du variant Delta ou du variant Omicron qu'on détecte, ça peut être dans la majorité des cas des gens qui sont déjà guéris finalement.
Je m'excuse, je pense que je n'ai pas complètement compris la question. Ça prend temps d'avoir le résultat confirmé par le séquençage que c'est Omicron, mais on a l'approche de la gestion des cas et contacts qui est là pour les voyageurs, qui peut contrôler la transmission. C'est juste que ce n'est pas parfait. On peut imaginer qu'il y a des gens avec cette variante, c'est possible que c'est dans notre communauté. Mais aussi, je m'excuse, mon équipe a confirmé qu'il y a une cinquième positive, aussi dans une voyageur, un autre voyageur. Alors, ce processus de dépistage pour les voyageurs et plus de restrictions pour les voyageurs, ça aide à identifier une autre et on a les mesures là pour aider avec le contrôle de transmission.
Merci beaucoup.
Sorry, could we get that in English as well on Omicron, unless somebody else is going to ask? Thank you.
Yeah, the team is confirming that there is actually one more person in a traveler who has tested positive for Omicron. And so this process of testing travelers and really more restrictions on travelers, it is leading to identifying Omicron and containing it in people who travel. But it's just hard to imagine that we could completely contain Omicron if it's as infectious as it appears. I think we can imagine that it is possible. It's in our community and will grow. But these measures help to slow things down, and it does make a difference. That's what we're trying to do, is make sure that we don't have growth that is too rapid, that reaches too many people all at once, that we can't manage. We want to keep it at a level that is manageable.
Thank you very much. Merci beaucoup. Merci Julien aussi. Et si jamais vous avez besoin des clarifications sur des particularités, n'hésitez pas à nous envoyer un courriel. Next up is Global News Ottawa with Craig Lord. Craig, over to you.
Thank you. Thanks very much for taking our questions this morning, Dr. Etches. In your holiday guidance, you mentioned a lot about being careful gathering with people, maybe you don't know their vaccination status or they are unvaccinated. In the example where maybe there's a family that's fully vaccinated or a group of friends that's fully vaccinated, how secure or safe should people be feeling about gathering, in a full group like that, or should there be extra precautions taken even if the full group is fully vaccinated?
Yes, of course. I think people should have confidence that the vaccine provides good protection against being in the intensive care unit, right? Worst outcomes, that is good. And we can have confidence in that. And so after that assurance, we also know that people who are vaccinated can pick up COVID, they can transmit COVID. And so it's a matter of how many people are you coming into contact with. And the more you add in more people, the more the chance that there will be COVID transmitted. And so that's one thing to keep in mind, rather than a really large crowd, make it a smaller crowd. And, if people are going to have many, many, many contacts through the holidays, then you want to add in some other barriers probably too, to reduce your risk. So you can wear a mask, you can keep your distance, you can be outside, you can open the windows. Each thing helps. So I think this is where, I think the people of Ottawa know the tools. They have these things they can use. They can assess their own risk, their health condition, the health conditions of people in their household. I think that we'll keep an eye on this. I think today's message is about there is a still significant population that's not fully vaccinated in the 5 to 11-year-olds. And this is a population where you do want to be careful about households mixing.
Thank you. Also along the unvaccinated route, when it comes to family gatherings, there might be difficult conversations that some parents might choose to have with an unvaccinated member of the extended family. Do you potentially have any advice for parents going through those kinds of conversations that might be saying, oh, you actually can't see your niece or nephew over the holidays because of your status and the choices that they're making? Do you have any advice for parents there?
I think if we go back to what we're all trying to do is care for each other. What we're all trying to do is be careful and keep each other safe. And if we're coming from that same motivation of care, explaining that this is for now, this is to, do our part to be careful, that we'll find another way to connect. That may work for some families. Each family is different, and some families may decide that this is what's important for them right now, is to gather and use other tools to decrease the risk. So I think people will have to make their own assessments, but this is for a good reason. We're trying to keep people out of intensive care units. We're trying to keep children in school. These are the things we want to prioritize during this period. And children are going to have 2 doses in February. So maybe you plan a holiday gathering in March and you say, we're going to postpone it till then. These are the kinds of things that it's tough to say, but I think we'd rather make it through this together, keeping things manageable.
Thank you very much.
Thank you, Craig. Thank you, Dr. Etches. Next up is CTV News Ottawa, Josh Prinkle. Josh, over to you.
Good morning. Thank you very much for taking our questions today. Dr. Etches, Christmas Eve is 2 weeks away. You're concerned about rising cases. The Omicron variant has been detected in Ottawa. It's been detected in Kingston in people who are not travelers. Are we at the point right now where you suggest that people should consider canceling their Christmas plans that they have and consider something smaller or staying close to home?
I'm asking people to think about how they can decrease the risk of COVID transmission in the social gatherings they're planning. So I'm asking people to prioritize being protected with vaccination to begin with, to get your booster dose on Monday. If you're over 50 and it's been 6 months since your second dose of COVID vaccine, it's worth it to get that 3rd dose. If your children are 5 to 11, you can drop into a school-based clinic. You can find an appointment in our clinics. This is worth it. So starting with that layer of protection, then thinking about how many people need to be there. Can we make it a smaller gathering? If we're going to have people who aren't vaccinated, are we going to have the masks? Are we going to wear them? Are we going to keep the doors open? Can we do anything outside? I'm asking people to think about this consciously. It's been a little while since I've said I'm concerned. So maybe people, haven't had that sense because there's a lot of things that are permitted now. But I'm saying now we do need to think. We need to rethink, how do we decrease the risk?
And my follow-up question, I know you answered this earlier about you're raising concern and you're trying to educate people right now. But have you given any consideration at all to do what Kingston has done, Windsor Essex has done, looks like Sudbury has done, and put new gathering limits in place of 10 people for the holidays because of the spread right now?
No, that is not something that we're working up, but I am thinking ahead. I am thinking about what's needed. The hospitalizations, are a really important indicator because that's what we're trying to avoid. And they're a lagging indicator. So today, the concern is we're seeing a lot of COVID growing in the 5 to 11-year-olds, and that will lead to hospitalization if we don't take some action. So today is focused on the 5 to 11-year-olds. If things don't slow in transmission, we do have to think about other things. And gathering limits in the homes where people aren't vaccinated, where people aren't wearing masks, that is something to consider.
And just to clarify, but you haven't thought of that as of right now, that's not on your radar at all.
I'm asking people to do their part to limit, themselves and to choose the things they know will work. In terms of having to go a next step to put this into some kind of other direction, that may follow if needed.
Thank you. Thank you, Josh. Thank you, Dr. Etches. Next up, City News Ottawa, Alex Gouge. Alex, over to you.
Hello. My first question is, so hospitals seem very stable, more or less, at the moment. At what level do you think there will be strain on the healthcare system in Ottawa?
So I've been talking to the hospital CEOs, and I can tell you they're already under strain, trying to operate with high demand, with needing to catch up on services and procedures. They have ICU beds they can make available, so they have plans, they have surge plans, but they have limited staff, they have limited people. And so it won't take very long at all until with the pressures and needing to admit more people with COVID, that they will have to revisit what other services they're providing to be able to staff and manage the COVID. So it's something we'll talk about again today. I'm in regular touch with them. I hope that we can continue to keep the COVID from reaching people who will have serious illness, but we just look around the world, other countries like ours, and we see that when the rates go up, it eventually does touch people that are more vulnerable. And so we need to be cautious.
And on a different note, how does Ottawa's 5 to 11 vaccination rate compare to the rest of Ontario?
I think that people in Ottawa have come forward at the greatest rate, and so that we probably at this point have the highest rate of immunization in this population of 5 to 11-year-olds. I think over 40% now. Very thankful for that. It will make a difference eventually. So first dose takes 2 weeks for the immune system to mount the response after a vaccination. And the full protection will come after 2 doses. Right now, the recommendation is 8 weeks apart. So the sooner the better. I do encourage people to keep coming forward. We haven't had any serious reports. Nothing that's concerning has happened after these children have been vaccinated. And I'm really proud of the children. Yet, some of them, and I would say, one in my family was not too pleased about the idea, but got it done, did it, and felt really happy afterwards to be able to contribute and help and have that protection.
Great, thank you. Thank you, Alex. Thank you, Dr. Etches. Lastly, we have CBC News Ottawa with Matthew Kupfer. Matthew, over to you.
I want to talk a little bit more about kind of that rollout of rapid testing, what you've said about managing the extracurriculars of the 5 to 11-year-olds, and I suppose the 5 and youngers as well. And you mentioned that Barrhaven is a part of the city that has seen an explosive increase in cases. Is this in part linked back to the closure of Half Moon Bay Public School, the cases that were detected at the Barrhaven Martial Arts Center? Is that part of what we're talking about here, and what some of this rapid antigen testing is in response to some of the issues that have been arising in that part of the city?
When we see the COVID rates go up in children who are in school and in extracurricular activities, it is linked. And then meeting with other households, and there's many different social networks, and the more different social networks and connections people have indoors without masks, it is linked. And so yes, it is where we're seeing this more explosive growth right now in Barrhaven, that many of the schools we're working to get the rapid antigen tests out to are in these areas in Barrhaven and others where we're seeing higher rates.
And I guess I'm feeling a little bit of mixed messages in what's going on here. Some of I understand that there's I think you said that we had the highest vaccination rate among the 5 to 11s so far in Ottawa for Ontario. People were probably getting some hope at how high the vaccination rate has been overall, but that also our indicators are very similar to where we were last year. You kind of mentioned the idea of Christmas in March, as opposed and these small the notion of smaller gatherings, but not an order to do that. People are exhausted. People were likely hoping that this holiday season could be some of that, a marker of that return to normal. And hearing concern in and of itself might not be enough to shake them off of their holiday plans. To have the tough conversations with unvaccinated loved ones that they might need to, I guess, like, really, what is the bottom line for what someone's holiday season, what this next month is supposed to look like for a family in Ottawa?
Yeah. So many things there. I want to be clear about the message. Things are different this year because of vaccination. So we don't have the same high levels of hospitalization, but they're not under control for the unvaccinated population, especially children 5 to 11. And so what I'm asking, people be vaccinated, but the 5 to 11, the high vaccination, I'm so thankful people are doing this. It's not enough protection for the holidays. For families with 5 to 11-year-olds, it's not protection today. I mean, my children were just vaccinated last week, but they're still not protected by the vaccine. And this is what the numbers are showing us, the elementary school outbreaks, the rates in this age group. That vaccine hasn't had enough time to protect them. And the second dose isn't coming until February. So this holiday season, when you have unvaccinated children, we need you to be limiting the contacts with other unvaccinated children indoors without masks. And so that means in extracurricular activities where it's indoors and crowded and no masks, I'm asking people to really think, is that the priority for your family right now? School needs to be a priority. And so to limit those kinds of higher risk activities. And yes, if things don't come under control, we will have to look at what other rules can be created. But the people in Ottawa have, for a long time in this pandemic now, responded to making good, informed decisions and using, we know what works now, right? So carefully wearing that mask, carefully choosing to be outdoors instead with friends. These are the things. And yes, if things don't come under control, there are other tools we can use. But I think that maybe parents haven't been really as clear about the vaccine doesn't work immediately, what's happening right now. And so that is the message today, and we'll keep monitoring every day.
Okay, thank you very much, Dr. Etches. Thank you very much, Matthew. So there you have it, folks. Lots of valuable information shared here today, lots to digest. But thank you to our media partners for all your ongoing support. It's because of you that we can help get the message out to residents. Donc, beaucoup d'infos aujourd'hui, beaucoup de choses à digérer et à répéter. Merci aux médias de votre soutien et c'est grâce à vous que l'on peut diffuser nos messages aux résidents et nous apprécions votre soutien. That is all the time we have for today. Thank you. Have a great day. C'est tout le temps que nous avons aujourd'hui. Merci. Bonne journée.
Merci.